Let's just sign it in paper and speak.
Yes, sir.
Mm-hmm.
274.
I've got this on, this is for the children and youth health. So this is not.
We gotta make sure,
We got
the only
we
25
still
people.
got some more
So we're
coming.
waiting for the
Creek
one for the BJ Williams.
What?
See if he's,
This is Senate Ag,
see if
right?
he's got their speakers, you know, I guess, we don't know.
Did they move the rail?
Man, this is right
I
here.
guess it's 2:30.
Okay. Oh. Sorry, I'm here early.
If you know their name and you know that they're coming, like if you're shouting about it, it's
We're not
fine.
gonna do that.
But once she pulls the sheet, she ain't gonna let.
Ours is two, I think, two out there.
Well, they sit for 2:30.
I got confused too.
Yeah.
They what?
That's what it
It's
said.
at 2:30. Meeting starts at 2:30.
This one's up at
I
2.
appreciate it.
Okay, you go to the one before hours.
Y'all ahead of us then.
We're on the other one.
Got you, yeah, there is one or two there. Sorry.
Oh, wait,
I
wait.
can't.
He may have found the wrong one.
Good.
That's for the children, that's for the children.
See, I just said you may have
they
found
said
the wrong
you-
one.
They said you probably sending the wrong one.
You gotta speak on that one too.
That is gonna be at 2 o'clock.
Now you gotta speak on that one too.
Pardon?
You gotta speak on that one.
Oh, I do.
Senator Williams.
Yes, sir. Give him this stuff.
You want me to come around?
Yeah, come. Show you a photo.
I was trying to give you a short
That's
but I might
fine,
have made
thank
it.
you, I appreciate that.
Might have made it
Really do,
longer.
thank you. I have got 15.
One right here.
I've got photographs.
We can pass
Okay, you wanna wait till then?
Yes, well, I mean, I can pass these pictures
All
around.
knows you gotta look through the screen.
Okay, why don't you do that?
Started, but I've got another one here. We may have to step outside.
So what I've got,
Couple.
I've got 16 of these packets.
Oh, okay, yeah, I can get the lady.
You wanna do that?
Yeah, I do.
That's on ball.
Now, we got another one, yeah, we got a bill now, another community. now.
4 hours.
How many people are here for ag?
No, we're not.
No, everybody here,
We're not.
nobody's here for agriculture.
That's what 230. Agriculture, forestry.
All right. Because if anybody's in here for ag, if I can ask you to step out,
Yeah, let's
so
probably.
the ones, we've got this next one, the one's going on here,
The
come
230,
in, I appreciate it.
there you go, that's fine.
Are you saying if we're here for a mile, we'll step out? Because that's gonna be a little
The
bit.
230,
Yeah.
yeah, the 230. If you would step out, I appreciate it, we'll get you back in. When, the next one starts. Thank you. Y'all whisper, mic's on. Yeah, just everything's what you say. Make sure you get in the key. If you want to give me the key, I'll.
Oh, I know. Yeah. All the little things.
You know, we're just waiting on the quorum to get here. There's a confirmations committee is going on at the same time, and we've got several members that overlap, including me and Senator Williams. But if you plan on signing up, go ahead and sign up. As soon as we get a quorum here, we're gonna get started. All right, I think we have a quorum. If you will, please call the roll.
Okay, thank you.
Senator Allen, Senator Bell, Senator Chambliss, Senator Coleman Madison, Senator Figures, Senator Kelly, Senator Kitchens, Senator Roberts, Senator Stewart, Senator Stutz,
Here.
Senator Williams.
All right, we have, I appreciate all of you being here, and we have one bill with a public hearing. Senator Roberts, you want to tell us a little bit about your bill, and then we'll start the public hearing.
Thank you, Mr. Chairman. Thank you for committee. Everybody's running wide open today, and I really appreciate you guys being here and appreciate those who have showed up to speak. We're dealing with kind of a new phenomenon over the last couple of years of this, what starts as hemp is then synthesized and then it's total synthetic, and it's synthetic THC. We can hear from Aaliyah, we can hear from all our forensics people who talk about the impact of what's happening in our country and particularly in our state. So we are dealing with, as we have Paula Green here from LSA, who can hit this further if needed. But on page 3, line 69, where we're here, we're in chapter 2. So it's in the medical marijuana section. And so that's why any psychoactive cannabinoids for personal use, if you are already approved for medical marijuana, that's why this exception's there. Any other use of it is not. So with that, Mr. Chairman, find out a public hearing.
All right, thank you, Senator Roberts. Looks like we have 2 opponents signed up. Is there anybody else that wants to sign up before we get started? Anybody else want to sign up before we get started? Okay. We're gonna have 3 minutes each, and we have Mitch Hungerpiller from the Easy Hemp Company. I pronounced your name correctly?
Yes, sir. Thank you so much. May I pass these around to you?
Absolutely.
We probably won't have them today. We have on the floor in a minute. Senator Bell may be our exception.
Well, if I can add,
In my car, I just drove from Birmingham. We've had news reporters, we've had public outcry, and distinguished lawmakers from the state of Alabama. I highly respect your duties, your responsibilities. I myself, as a licensed certified public accountant for 30 years, serve the public, and I would in no way ever advocate for anything that harms children in any way. What I'm here to talk about is really the difference between responsible hemp products that are manufactured in federal compliance with strict regulation with the federal law, and the novelty items that has brought concern and public outcry. And just to give you an example, I've been a licensed hemp processor and cultivator since 2000, and have followed the hemp farm bill very closely. My family has owned farms since 1817 in Dallas County, and through the generational transition, I have been the treasurer since 1992, and I'm very familiar with how farming and federal and state subsidies occur and so forth. And some of the things that we had to do is we had to enroll in the crop rotation program, et cetera. I'm an entrepreneur. I have a PharmD pharmacist that is our medical director. That drink is 340 times less potent than some of these items that novelty items that are being discussed and are at risk. And I just want to make the distinction between these 5 milligram and 3 milligram beverages that are sold responsibly throughout in my manufacturing product less than a year, over 500 locations in 8 states. We're bringing jobs, we're bringing awareness to responsible adult beverages. We support regulation, we do, but please don't throw the baby out with the bathwater. We have spent millions and millions of dollars working in federal compliance, state compliance under the Department of Ag throughout the last several years. We've employed lots of very smart people. We've employed, given hourly workers opportunities to work. And I just ask that we do this responsibly, and that you listen to your constituents and you listen to those in the public around not only Alabama, but around the nation.
Yeah. Thank you. But if you don't mind, your time's up, but I want to ask you a question. when you compare to an alcoholic drink, one of these, as far as impairment, as far as the buzz you get, can you tell me a rough equivalency of an alcoholic drink? And these, I read the label, contain 3 milligrams of THC. So is there, what's a rough correlation?
It's roughly based on everybody's body is different. One of these 12-ounce servings is equivalent to about 2 ounces of wine or a 12-ounce domestic beer, not the free the hops high gravity beers. And it's maybe an ounce of spirits that are there. It's very low. In some people, we naturally produce THC and CBD in our endocrine system in our bodies, and our bodies have been starving for this. And so it really helps some people. Some people, you know, we all like to drink with our friends socially, maybe not everybody, but some people can drink 1 or 2 whiskeys and get kind of silly and sloppy, and others can drink 3 or 4 and you never know that they've had a drink. So it's a tolerance level, and everybody, and all the doctors and all the pharmacists will tell you. That's when you go to get a pharmacy. I have a prescription 0.25 milligrams. Some people take 10 milligrams of this prescription. And so we have to be responsible parents and household folks whenever we bring it into our home. But there are a lot, you know, look at the poison control, and there are a lot of things that take people and ingest in our household components that are sold as common consumer products. So yes, the other high gravity that are 300 times more potent, I'm an advocate for that. Do something with that. But please don't do something that is a healthy alternative to alcohol for people that don't want to overindulge. There's no sugar. A lot of people are diabetic. They take a lot of medication. They can go out and be social. I have a military 2-time veteran who was a sheriff deputy that he's testified we changed his life. He said, I can now socialize and not feel as an outcast drinking water when I go out to a James Beard restaurant or go just hang out and watch Alabama or Auburn football game.
So let me ask you another question. Comparing it to alcohol, you know, we have problem drinkers. There are alcoholics. Are there THC-aholics? Are the people that get hooked on it, use it every day, can't do without it?
The National Institutes of Health and the CDC there's been limited research, as you know. We only have 7 years of research. The University of Mississippi was one of the few federally authorized marijuana and THC research companies beginning in the 70s and 80s. And actually that crop was grown just north of Tuscaloosa. And I've spoken with Ms. Andrews, who's the PhD. So the science says that it is less likely to become dependent on anything that's hemp or THC derived. There's no hangover. It is actually healthier. It doesn't damage your liver. It's all in moderation. I mean, we can all eat too many sodas. I mean, look at what's happening when we drink high sugar sodas. I mean, HHS has just come out and said that alcohol is horrible. I mean, if you're familiar with the federal level, I mean, the federal level is actually looking at what is going on. There is a tidal wave, and Alabama has a chance to really be a leader. We have some of the best research institutes. Clinical trials need to be studied. So the research in Birmingham, they have studied just about every pharmaceutical clinical trial. It takes 10 years. Dr. Latati, who's our medical director and a PharmD, taught pharmacy at Sanford and also consulted. He's an innovator. He's an owner of 3 patents. I was with him this morning. Everybody has different tolerances for anything that is an intoxicant. But I'll tell you, based on my own personal experience, there are dozens and dozens of Alabama citizens that have said that we have changed their life with these small amounts in this product class, and this is a new emerging category.
One other question, I don't mean to dominate the question. What about, addressing the, metabolism of it? I was just skimming the label there. I saw it, it said that the effect would last for 1 to 2 hours. So can you address the metabolism of THC?
Yes, sir, I can. There's several ways, you know, corn, soybeans, grapes, apples, they all have different uses. They have industrial, they have nutritional, they have medicinal and recreational. You know, who would have thought that we'd be pumping ethanol into our gas tanks 20 years ago? So the metabolism, this particular oil and water don't mix. The cannabinoids that come from the hemp plant are oil. So there are new sciences that have been developed to emulsify the particles in the oil. And the oil, with a lot of the manufacturers, they just put the oil in with the water, and it kind of separates and so forth. Our scientific work and our research over the years has allowed that to mix really well, and it allows to go into your system in a different way than some of the oil-based, which take an hour or two. So that's why it's 10 to 15 minutes, because it's emulsified, it's water soluble, and it's ready for consumption. And we put, and the science shows that CBD neutralizes the THC receptors. So that's why we put a little bit of equal CBD in with the THC, so that if somebody's sitting and drinking it, they work together to neutralize. Whereas with alcohol, I mean, it takes, you know, a long time.
Any other questions? All right, thank you. I'm sorry to hold you over after your 3 minutes were up.
Sir, I've committed the rest of my life to helping society and answer your questions.
All right, thank you. Next, we have another opponent, Carmelo
Arceliti.
Arceliti.
Yes,
Okay.
Don't start my time here. Mr. Chairman, you realize that's 2 miles today, the phone is still off. I'm scared what you had for breakfast.
I know. I think since we're building a new state house, we can't afford to put new foam on any of these mics. They're just disintegrating. It was in about 4 pieces as well. Ready, set, go.
Well, first I want to go back and answer one question. You know, compared to alcohol, how does it compare with hemp? Hundreds of thousands of deaths. Alcohol is attributed to hundreds of thousands of deaths. For hemp, there is no direct causation of overdose deaths from hemp. This is going to make simple possession of misdemeanor felony. It gives more power to Alabama's failed medical cannabis program. It eliminates access to safe and effective hemp-based products for thousands of Alabamians, and it criminalizes licensed farmers and processors like me and Mr. Hungerfiller. There's thousands of Alabamians, including cancer patients, veterans with PTSD, and those with Parkinson's, seizures, and anxiety, and chronic pain. They currently use these hemp-derived products safely and effectively. If you go to the last page of this handout, there's a QR code where we interviewed several veterans, police officers, firefighters, amputees, cancer patients, and they give their experience on how these products have helped them. All of our products we make are third-party tested by DEA, accredited third-party labs, ensuring purity, potency, and consumer safety. My company, we founded a cancer, Parkinson's, and seizure relief program where we give these products either at no cost or reduced cost to these folks. And they're referred to us by doctors, local doctors. The medical cannabis program has failed. It passed in 2021. Alabama's medical cannabis program has yet to serve a single patient. Licensing has been plagued by corruption, lawsuits, and bureaucratic delays. That's what the newspaper headlines have told me. And instead of fixing that program, SB 274 hands more power to it, rewarding failure while punishing patients and entrepreneurs who follow the law to a T. There's patients in Alabama that need care now more than just what we can do, and they don't need more broken promises or restricted access. Licensed hemp growers and processors went through the proper legal channels under the Alabama Department of Agriculture. We've invested hundreds of thousands of dollars, millions for some, It would make us felons overnight, destroying our businesses, our livelihoods, and no warning of compensation. And 3 minutes is not enough time for me to plead for my livelihood. There's no death, there's no data, there's no justification. There's been no economic impact study on the damage this would cause to small businesses, farmers, processors, the tax revenue that goes to the state, patient access. Let's see. We should be, we're for regulating, we're for 21 or older. We don't think children should have this, but it's also about educating parents and educating these folks that you can't just let kids get this. And you know, more people overdose from Tylenol per year in the U.S. than hemp. There's no deaths recorded with it. So, you know, back to your first question, there's really no comparison in the two besides some of these cannabinoids are intoxicating. Any questions?
So yeah, you're right on time.
I knew it was coming close.
2 seconds. Again, I don't want to dominate the questions, but I've got a couple. If, you know, we're told that, as far as impaired driving, this past year, THC impairment surpassed alcohol impairment in the state. My question about the metabolism, earlier, as I understand it, alcohol is more of a linear metabolism and more predictable of how quickly it gets out of your system. And there are easier tests for it. And, you know, if you're,
you can do a breathalyzer.
Yeah, do a breathalyzer. If you're a certain level of drunk, we can predict that in X number of hours, you're gonna be sober.
And unfortunately, you know, cannabis hemp derived products, they can last up to 30 to 120 days in your system.
Yeah.
That doesn't mean that you're still feeling the effects from those. They bind to the fat molecules, so someone like me, it's going to stay in my system a lot longer than someone like this lady over here who doesn't, you know, isn't big. But so, you know, there's a lot to do, and just because that's the case, it doesn't mean to restrict access to Alabamians who are of age and choose to use a product that's proven safer than tobacco and alcohol.
Yeah. But my question about that is, when you look at protecting society,
Sure.
and I wasn't thinking about this until we started talking about it, but my question then is, if we're charged with protecting people from things that are harmful, you know, I mean, I've got a libertarian bend too, and I understand the government can meddle with too many things, but overall, we regulate a lot of things in the I guess, purview of public safety or whatever, from speed limits to whatever you want to talk about. Anyway, so my question is, with that unpredictable metabolism, these things are available. What about school bus drivers? What about people with CDLs? What about policemen that judgment might carry a gun? What about all these
currently,
things?
those are corporate policies that have rules assigned with those jobs. I know school drivers, they're not allowed to take CBD products or any of these products for fear of this metabolization. Same with, I have several police officers that shop with me. They say they would rather ask for forgiveness than permission because it helps them more than using alcohol to medicate themselves. But these would be, you know, laws that needs to be handled by those corporations or those jobs. But you know, growing up, I remember you couldn't turn on the TV without seeing, you know, DUI checkpoints and educational commercials about not to drink and drive and educating people on the dangers of this. You know, we need to have a campaign educating the folks on the dangers of using these and driving, not banning and not prohibiting. It's an education issue, I think.
Yeah, so you agree then that, I mean, that we've got a problem. I stopped at a convenience store driving down here yesterday, and there were a package of, I asked the owner to show me some of his inventory, to show me some of his samples, and it was right there on the counter by the cash register. There was a,
Did you take any and drive? Did you take any and drive?
I didn't buy any.
Good. So
He
you're
just
educated
showed me the
to know not
samples.
to-
And
not to drive.
I didn't drive with it.
Good.
But he had a package of 2 cigars that had 2.5 grams of THC in those 2 cigars.
Okay, so let's do the math. If it's below 0.3% and we're at 2.5 grams, that would be only a few milligrams of THC in that, if it's legal and compliant and we're by the federal farm bill. Now, bad actors should be punished. Bad actors who are selling things that are not labeled should be punished. You know, everything we sell has a warning. Do not operate heavy machinery. Do not drive a vehicle. You treat this like alcohol. If you're gonna go open a bottle of Jack Daniels and take a swig, we have the common sense enough to know not to go drive a vehicle. These people who are driving under the influence, those are bad actors. We shouldn't, you know, again, punish the entire industry for bad actors.
Yeah. So, well, thank you for any other questions. Anybody else have any other questions?
Thank you.
So let me ask you one more, so you get your money's worth too, longer into Mike. If you agree, do you agree first? Do you agree that we have a problem?
I do not think we have a problem.
So you think what's going on in convenience stores and stuff right now,
if we look at
teenagers having access, large milligram amounts that are in the products in convenience stores, you don't think that's a problem?
Things like THCP, HAC, synthetic cannabinoids, I think there's an issue. But again, 15, 16, 17-year-olds getting them, they're not buying them from reputable stores. They're buying them from bad actors, or they're using a fake ID or some form. So I don't think we have a problem. And then you also go a step further, you know, using the CDC data, you know, 238 kids in 2023, but that's out of 1.2 million people under 21. That was 0.013%. How many deaths have occurred last year? How many deaths have occurred from chemicals under the sink, or Tylenol, or alcohol, or tobacco? It's not comparable. And we're talking about a safe and reliable product that can be dosed properly if handled correctly.
Yeah. Okay, thank you. No other questions from anyone? Okay, thank you
for your time, Mr. Chairman.
Senator Roberts, what would you like to say in conclusion about your bill?
We have 5 bills in this, maybe 6 right now. I believe we're gonna come up with something that works. I am not in favor of this, and I appreciate both of you guys being here and speaking about it. I have 3 sons. I have a middle son who's been in 15 rehabs, and I firmly believe the gateway is right where we are here. So that's my personal story. So I have 10 grandchildren. My goal is to protect Alabama. I think you're seeing other states strive to ban this. I think there is a whole lot of momentum on the other side, and we'll see where we come out of here. But that's the reason I filed this bill. So thank you guys for making an effort to be here. With that, Mr. Chairman, I ask for a favor report.
Sure, second. Second. Okay, would you call the roll, please?
Senator Allen, Senator Bell, Senator Chambliss, Senator Coleman Madison, Senator Figures, Senator Kelly, Senator Kitchens, Senator Roberts, Senator Stewart, Senator Stutz.
Aye.
Senator Williams.
6 to 1, the bill's given a favorable report. Thank all of you for being here. As Senator Roberts said, this is an issue that we are trying to work through, moving these bills out of committee. I think there's 3 bills today that are all going to be moved out, and we're talking about a resolution to try to study the issue, but we're going to keep these bills moving late in the session and see where we end up with the final product. Thank you all for being here. The meeting's adjourned.
I love it. Bring it on. Hey. Yeah, pleasure.
Yes, sir. Oh, okay.
Here is my Yeah, we're right.